And now, without further hesitation, let me introduce our presenters for today, Vanessa Kramer and Chad Ramsey.
Hi there. Thank you, Tony, for that wonderful introduction.
Yes.
We're so happy to be here. And here we are at the tail end of our first virtual conference. Hope everyone had a great time, technical difficulties notwithstanding. But I think that before we really dive in, there aren't very many slides, and really what we were envisioning for this session and what we hope to have is kind of an informal, very conversational session. I scanned through the people who are in attendance and I don't recognize a lot of names, so I'm assuming that much of the audience are people who are interested in advocacy and are possibly new or unfamiliar with our platform. Chad, I don't know if you want to add to that there.
Yes, absolutely. Thank you, Vanessa. And we really appreciate you coming here. Conference is almost done. I'm so proud of everybody for the work that you've put in over the last few days. I've found it to be very inspiring. I've learned a lot. I think, like many of you, was really skeptical on how this would come across virtually. And while I miss seeing all of you and being able to hug all of you and talk to you and share a drink with all of you, I've really gotten a lot out of this and enjoyed this experience. And we're really grateful that you hung in with us for this session today. We decided against putting together a real formal introduction program for this because we really wanted to leave lots of time for questions. If there are any questions that you might have had from our previous sessions, either the session on how to talk about genetic testing or the section on addressing diversity through advocacy. Vanessa and I are here to answer any of those questions that might have come up. But we did want to give you a little bit of information about the advocacy program here at Ovarian Cancer Research Alliance, and also make sure that you were well acquainted with us. You got to meet not only Vanessa and I, but the rest of our team. So we're going to go through our slides. It probably shouldn't take too long, and then we're going to leave plenty of opportunity for questions. Maybe we'll do some play acting at the end on what a meeting might be like, but we'll see how it goes. And if there are any questions that pop up, use the chat or just interrupt us if you can. If you do interrupt us, please wait till we identify you so that we don't have people speaking over each other. Hopefully that sounds good. So as we said, here's our agenda. A little bit about us and the program, particularly the Advocate Leaders programs that we have. We'll give you a little bit more information about that, and hopefully there'll be some people on this session who are interested in joining that program, because I think I've already talked with a few of you who I think would make terrific additions to our Advocate Leader program. So hopefully we'll have that. Then we're going to try to get some feedback from you and offer you an opportunity for follow-up. So that's what's on our mind today for this session. Hopefully that sounds good with all of you. And I realize that I don't have there it is, my chat box open, just in case anybody decides to give us a chat during, we'll be monitoring that as well. It says here, we're based in Washington, D.C. Vanessa is in Washington, D.C. right now. And I'm across the Potomac in Arlington, Virginia right now, but our office is in downtown Washington, D.C. So it's a good headquarters for us to be able to get up to Capitol Hill at a moment's notice, or be able to interact with any of the federal agencies that we do on behalf of the ovarian cancer community.
And along those same lines, if any of you are ever in DC, you're more than welcome to stop by our office. I know a handful of you on the call have already done that, but we always love to have a visitor and go get coffee. We love to meet with people from the community. So
that's right. And you know, as we mentioned here on the slide, I'm not sure where that came from. On the slide, we have a small but mighty staff. We have there are 4 of us in the DC office, typically. 3 permanent staff, and 1 fellow who rotates on an annual basis. And so I would like our other 2 staff members to introduce themselves now, and tell us your name, and tell us where you were born, and then one incredibly important, no, interesting fact about you. So I'm going to Rohan, if we could start with you. And make sure you unmute yourself before you try to talk.
Hi, thanks, Chad. My name is Rohan. I'm the Programs and Operations Assistant at OCRA. I do a lot of the point of contact for the Advocate Leader program. I was born in Boston, Massachusetts. And an interesting fact, my family used to own a movie theater in India a very long time ago.
Wow. I did not know that. That is super interesting.
Yeah, very small, like 1 screen type place, but yeah.
That's great. And Rohan has been with us since about the beginning of the year. So now it's been, wow, I can't believe we're only in the office together for a few months before we all decided to work from home.
I know.
So
Rohan's had an interesting experience so far. He was sort of thrust into everything, and then the world changed with COVID.
That's right. Thank you, Rohan. And I'd now like you to meet Odia Kane, in case you haven't yet. Odia, could you unmute yourself and introduce yourself?
Hello. So I'm Odia again. I was born in New Haven, Connecticut, and an interesting fact. I grew up in a house with 11 other people and 1.5 bathrooms. So that was quite the adventure.
Wow. That means quite a lineup in the morning, I think. Odia has been with us since this early summer. She is our Ann Coulter Policy Fellow. She is our 4th Ann Coulter Fellow, and the Ann Coulter Policy Fellow is a position established by Peter Coulter and his family and friends to honor his late wife, Ann Coulter, who was one of the founders of the Ovarian Cancer National Alliance, very interested in policy from her diagnosis on. And she passed away a few years ago, and this fellowship was established. And Odia is our latest representative, and she's fantastic. We're very happy with the program so far, and the 4 of us work very closely together, and we try to get as much work done as we can. Now, since we're in Washington, D.C., a lot of our focus is on the federal, at the federal level, annual appropriations process, making sure that there's coverage that's proper for ovarian cancer community and for patients, trying to ensure that there's educational materials that are made available through government resources, trying to make sure that the National Cancer Institute is studying ovarian cancer, putting enough resources to that along with other programs at the Department of Defense. But there is also some work that we try to do at the state level. Given that we're not an incredibly large staff, we often have to rely upon people like you to let us know what's happening at the state level and actually do the contact and do the outreach to local members of Congress or state legislators, mayors, city councilmen and women, and governors. And so there is a real strong relationship, and we rely heavily on our advocates. Vanessa has actually been spearheading more of our state level work as of recent, and we're hopeful that that can grow moving forward.
Yeah, just to piggyback off of what Chad said, I think it's important to note, right, that we don't have, like maybe an American Cancer Society, a larger organization, we don't have state chapters or regional sort of branch offices, right? So we really do depend on our advocate leaders, and then also by the same token, and there's a lot of overlap here, but our community partners, which are the smaller local state level organizations. We depend on them to help organize on the ground because we are limited, right? We do have a small and mighty team. We are based in DC, so with those factors, and given, that we are also a tight-knit disease community, we can work really effectively together and leverage off of each other.
That's right. And also, in order to gain more leverage, we participate in several coalitions with like-minded organizations and groups that we find to be very helpful. Just as an example, we're part of the Cancer Leadership Caucus and the Deadliest Cancers Coalition and One Voice Against Cancer. And then several other that are more specific policy-based coalitions that form on an ad hoc basis. So we find that working together with other like-minded or adjacent organizations and people is a very effective means of trying to do more with less. And so we're very grateful for those opportunities. And I'm sure that you probably do this at the local and state level as well. There are certainly community partners that we work with at the state level, particularly that have a lot of relationships with other types of organizations, whether that be to help fundraising or for community awareness or for support. It's very similar to what we do, except for our groups are focused on policy. So we're very, very grateful for those relationships as well. But what we really wanted to spend some time talking about next is our Advocate Leaders program. And this is a program that I think we're all extremely proud of, and we're very grateful to have the relationships that we have with our terrific existing advocate leaders and advocate leaders that have been part of the program over the years. Let's see here. So here's a little description of the Advocate Leaders program for those of you who aren't part of it, and for those who might want to be a part of it. This is a group of grass top advocates. And so you might not have heard that term. Grassroots is really what we refer to as the people on the ground who are actually doing the work. They're knocking on the doors, they're making the phone calls, they're at the community health fairs. They're the real people that you rely on during different types of campaigns to get work done.
To give a real life example of that, sorry to interrupt, Chad, but right now around elections, you're seeing a lot of grassroots level activity. It's basically anyone taking it upon themselves, practicing their civic duty, and going out kind of for their cause. And the reality is, and it bodes well for us, that more people, for whatever reason, right, since 2016, are interested in becoming active in some way, shape, or form. So we've seen the way that translates for us is we've seen an uptick in applications to the Advocate Leader program and interest levels, which is great. But that is just to bring it full circle with grassroots, grass tops.
That's right. And so what we really considered the grass tops leaders are to be people who are at the local level who have more of a leadership role and who are really key opinion leaders in their area and really want to make a commitment to advocacy. It's not people who maybe, a couple times a year will go make some phone calls or knock on some doors. It's really people who have a commitment to advocacy and really want to and are able to spend a little bit more time doing the work. And so we're very grateful to have access to a good, strong group of grass tops leaders across the country.
To build off of that, I think too, what's really important to emphasize here is that there's no expectation, if you're part of the program, that you have a background in policy making or in any of the sort of machinations of elected officials of how sort of the sausage is made. That's not necessary. I think what is more important than anything else is that you do have some influence and that you bring a level of passion to this issue, and that you're comfortable talking about your story with a broad audience.
Yes, absolutely right. it's interesting, you know, as the program has evolved over the years, some of our advocate leaders have become much more sophisticated with respect to policy and how it works after having no previous exposure to it. And I think that is, we're grateful to see those types of, that type of progress. But others will come in that have worked on Capitol Hill or have worked for local legislators. And so there's a great mixture of experience and work. And then everybody has their own particular story to tell. And that's really, I think, what makes the program so successful. And it's really grown over the years. Just 4 or 5 years ago, we really only had 15 or 20 members. And this past class, we had over 60 members in the Advocate Leaders, representing 41 states. So we're very excited about that. We're excited the organization is being able to commit to the resources to help grow the program. But really, we've seen an astronomical growth in interest in the program. There were 115 applicants for the program last year, and there were 115 applicants the year before as well. So we're really excited, and I think that means that there is a need and an interest in making this program grow. So we'll hopefully be giving you some opportunities to learn about a little bit more about that as we go on.
And to dovetail what Chad has said, you know, ultimately our goal is to have advocate leaders in every 50 state, and in all 50 states, excuse me. It is important to have visibility across the country. I think increasingly in the healthcare space in particular, each state is almost a policy laboratory unto itself and really varies dramatically when it comes to healthcare policies. So having people, I guess, for lack of a better way to put it, not necessarily doing our bidding, but, you know, Chad and I can go to the Hill and we can meet with members of Congress till we're blue in the face, and we can say, will you please support this? It will do X, Y, and Z for the ovarian cancer community. But at the end of the day, we're lobbyists. It doesn't mean as much coming from us as it does from a voting constituent. In fact, it means very little coming from us. So the advocate leaders are kind of where the rubber hits the road. I think that Chad and I are sort of constantly humbled by how often we're trying to get a response from a particular congressional office, and we try and try and try, and then we'll ask an advocate leader who is a constituent to reach out on our behalf. We'll tap into them and they immediately get a response, and it's a supportive one at that.
Yes, and I mentioned this on another breakout session that we had. This happened just a week before last when we were hopeful to get Lisa Murkowski to co-sponsor Ovarian Cancer Awareness Month resolution, because we didn't have a Republican to sign on to be original co-sponsor. And we reached out to her office and got no response at all. And then we asked Tiffany Briggs, one of our advocate leaders, to reach out, and she got an immediate response from the staffer. And they said, well, they don't, that Senator Murkowski doesn't normally sign on to these types of things, but Tiffany laid it on thick, as she said, and we a couple of days later got the response that Ms. Murkowski was going to sign on as an original co-sponsor. And so that type of work and that response from members of Congress really gives you an idea of the power that you can have as a constituent and a local advocate. And we want to try to engender that skill and power in anyone who's interested, and the more, the better for our whole ovarian cancer community. I think,
yeah, and I think it's kind of neat. It's good and it's bad, right? It's a double-edged sword. We're a small disease, or our disease incidence is smaller relative to other cancers, and we don't have a ton of visibility, right, relative to other cancers. And so it's almost like that's why the program is so important, to go to the Hill and to show Hill staffers, survivors, and to be sure that they are familiar with the issues facing our community. But it's also, I think, why it means so much when they do go in to their members and make an ask, right? It is because we are a smaller community. It does mean that much more. So it's kind of an interesting dynamic, because I'm always pleasantly surprised by how easily, really, like without even having to lay it on very thick, our advocate leaders are able to get support from members who, you know, I've been working in this space for 10 years, and members who frequently don't give much support for anything.
Yep. So we wanted to give you a little taste of what the Advocate Leaders program is like. And if we miss anything, any of our current Advocate Leaders are deputized to unmute and holler at us and make sure that we're getting it covered. I have no doubt that you will feel comfortable doing that. So generally, we have monthly calls. We started doing the calls via Zoom pre-pandemic in January. So we're very familiar with that medium. And the calls are usually an hour long, where we provide updates on what is happening and legislatively, and we solicit feedback on what sort of work you have been doing at the local level, so that we can know what is happening. We generally provide updates on key legislation that we've been working on, and let you know if there are any specific asks that we might have during these calls. It's important to attend as regularly as you can, although we have now adapted the technology so that we can record the calls and you can watch them afterwards. But we do really, I think it's beneficial to be on the calls live as much as possible. We also do some occasional calls in between, or webinars when there are important details and information that we want to share. And then there's a web communication platform that we use called Basecamp, where people can communicate and where we post information about the latest happenings, like who has co-sponsored a particular bill, or links to a particular alert that we'd like you to take part in. So that's the sort of monthly activity. In Ovarian Cancer Awareness Month in September, we also encourage our advocate leaders to participate in some sort of awareness activity. And man, there was some great activity this past September. We saw a lot of people were able to get resolutions passed at the state level, and we saw some great coverage there. I saw the Greenbrier in West Virginia was turned teal. A lot of amazing events were done. Some people do these year round for their local organizations and the partners, but I've been so impressed the type of awareness activity that we saw this past September. And so that does nothing but makes people more aware of this cancer. And so we're always grateful to see that. The keystone of our Advocate Leaders program is our Capitol Hill Day, which we have our Spring Advocacy Day every March here in Washington, D.C., where we fly all of our advocate leaders to town. We put you up in a hotel for a couple days. We spend all day in a training session, usually on Monday, to make sure that you know the latest and greatest details and that we have you well prepared. And then Tuesday, we send you up to Capitol Hill to meet with your members of Congress and their staff. And there's nothing more gratifying than seeing a sea of teal shirts and outfits just taking their place across Capitol Hill, whether it be on the steps of the Capitol or in the lobby of the Hart Building or up the front door at Rayburn. It's just amazing to see all these incredible advocates. And we always have amazing stories about, member of Congress coming out and specifically agreeing to doing something or signing on as a co-sponsor or just agreeing to be supportive. And, it's just a really gratifying day for me. And I hope the rest of the people in the program.
That's right, Chad. That's right. And I think that the next bullet gets into all of this, begs the question, of course, so what is the application process like? Where are we now with the program, given that, you know, the keystone, as Chad said, is this fly-in day? So, you know, because of COVID, and it's interesting because COVID nearly ruined our fly-in day in March. It was right at the very beginning, and a lot of Hill offices tried to cancel on some of our advocates who had come out, and we pushed back. I think only a couple ended up canceling, but it was right about, I think, like the day after everyone left, the Senate office buildings closed to meetings.
Well, yeah, and
But
we really, I mean, thought of canceling as well, because it was just starting to seem to be problematic. And so it was a very tenuous time.
right, right. But all of this is to say it's been a little bit still defying for new advocate leaders, because some of them didn't go to this. And we do ask that all new advocate leaders, it is a requirement to be able to attend this fly-in day. So some people bailed, and of course they weren't penalized for it from a programmatic standpoint. But the point of this story is that kind of our normal process for onboarding and for initiating was thrown by virtue of COVID. And there's also this whole other revolution, as everyone knows, because you're sitting right here in this conference right now. But we're also seeing the virtual space take off, and a lot of organizations are now having fly-in days virtually. We, of course, would rather have our fly-in day in person, just as we'd rather have our conference in person. But given that things are shifting to virtual, it affords us the opportunity to expand the program and to grow kind of in different new directions. And typically, we open the application process around conference, right after conference every year. So that's July, right? And it closes, I think, end of September, early October. And typically, we would be in the scoring and interview process for this. However, because of everything that's happened this year and these extenuating circumstances, we're hitting the pause button, but with an eye toward really availing ourselves of these new virtual opportunities, and, you know, maybe having a fly-in day before our normally scheduled fly-in day, or we're figuring out kind of what the next year looks like to the best that we can, and exploring some of the virtual platforms that are available. So all of this is to say, whenever, at least for me, whenever we have these sessions, these sort of open season sessions, I'm so happy because I see how much interest the program gets. And then invariably at the end, someone will come up to me and say, you know, I've applied and my state is already oversaturated with representation. And our hope is that vis-a-vis these new sort of virtual opportunities, technological opportunities, advancements, what have you, all of this being brought into the mainstream because of COVID, our hope is that we will be able to really increase our ranks, because it is really important. And I guess the second thing I just wanted to be clear about, because I think in the past there's been some confusion about this, because from our perspective, and really from your perspective, anyone who has a dog in this fight, you know, the bigger, the louder, the better. We have our fly-in day, we open it up to the public, meaning that anyone who wants to come can come. For advocate leaders, we sponsor you, so we fly you out and everything is paid for. But at the same time, we want anyone and everyone who has an interest in coming out and you know, representing us and participating to be a spokesperson for us. So I don't know, all of this comes with the caveat that who knows what next year will look like. Of course, we are hopeful that we'll be able to have a fly-in day in person, but we're figuring that out in the next, you know, several weeks.
That's right. And so we will, yes, in a couple of weeks, we'll be opening the process for applications. And so we want to make sure that we don't miss anybody who might be interested. So we would like you to communicate with us as much as possible if you're interested already. But we're also think that we'll be on social media and doing some emails when we open up the process. So we really want you to keep an eye out for it. But just in case you're interested right now and want to be interested, if we can go to the next slide, you'll see how to communicate with us to get that information, to make sure that you receive an application a link when it goes live. And I would recommend particularly emailing Rohan, who's got unfortunately the longest name on there. But he's the best person for you to let know, because he's going to be the main point of contact when we send out those application forms.
He's our front line of defense.
Yes, exactly right. So with that, we're going to hit a pause on the sort of formal portion of this, and if we can remove the slide from the screen so that we can see everybody's face. Thank you. We can open it up to anybody who wants to chat, who has questions, or who wants to tell us that we're doing something wrong.
You know me. I always have something to say.
Carla.
I just want to say that if you are in some place where there's a community partner organization, sending someone to Washington for the fly-in is in my opinion, one of the best uses of those funds that they may have had donated, even if it's a special fundraiser for the money for the hotel and the flight for someone. It's not a lot of money for a lot of groups to do. You could do a bingo night. We have down here, we have, what do they call them? Drag queen bingo. In one night bingo at a bar, you can get plenty of money to send somebody to the fly-in. So I think it's, even if you can't afford to pay for it yourself, see if there isn't someone in town who will.
Thank you, Carla.
Thanks for saying that, Carla. Yeah, I would like to echo that. I mean, obviously it's self-serving for our interests, but I do think actually it's you who walk away with the relationships. And it is something where the Hill, well, there's a lot of turnover among staff members, so they might switch offices. It's a sticky place, meaning that once you get on, a lot of times you don't leave. So some of these relationships even evolve, and you may not be a constituent of an office, but because you become attached to a staffer, you retain that connection.
Well,
so
it's
really
true.
Great.
That's exactly right. And I can't tell you how many times I've been walking with an advocate leader, let's say Frida, and we see her member of Congress, and he immediately runs to give her a hug and tries to figure out what he can do to help her. That happens with so many. You build those relationships, and you become an important person for them to see, and that is so helpful. You're representing your whole community in those instances, and you're really making a difference if you form those relationships, because members of Congress have a lot of power, and they legislate by anecdote. And so if they happen to know someone in their district who's suffering from ovarian cancer, or who has a family member who's been diagnosed, or needs help with getting coverage, they're more likely to take action on important legislation that can have an impact. And so we're really grateful, and we really encourage people to come to DC when it's possible. We usually have about 100, in the past few years, we've had about 100 people for our Advocacy Day, and we think that there's room to grow that.
For sure. And shifting gears, just because I see Cheryl has sent out a chat about it, and there is actually, I think there's a really natural segue here. One of our bread and butter issues is Johanna's Law. So Johanna's Law, and this is bread and butter. By that I mean it's something that we are constantly beating the drum for, and we will be through the ages. So what is Johanna's Law? Johanna's Law is a program at the CDC that funds a variety of different research activities and a lot of public awareness, data collection, things like that, around gynecologic cancers. And it's named for Johanna Gordon Silver, who died of ovarian cancer in 2000. Cheryl, I don't recall off the top of my head. I want to say in the early aughts. I don't know if she's muted. But
Yeah,
Cheryl
Cheryl, if you're
Silver.
trying to talk, you're on mute. And so you can,
Cheryl
there you
Silver
go. There
built a
she is.
hell of a grassroots campaign, and it's really a feather in her cap that this was enacted. It was the first federal program of its kind. One of its big programs that it funds is called the Inside Knowledge Campaign. And this, you can go to CDC website. You can order these materials free of charge. They're excellent materials. They're awareness materials for all 5 of the main gynecologic cancers. And in addition to the Inside Knowledge Campaign, it funds a lot of different studies, a lot of different various sundry research activities. So in Congress, when you pass something, you authorize it, right, for a period of time. So that means that you're giving the Congress permission to fund the legislation. That's what an authorization is. But Congress can fund any program at its discretion, even if it's not authorized. They're required to fund authorized programs. Here's why this matters, and hopefully I didn't get too sticky already. But Johanna's Law, because it was originally authorized and has been since reauthorized for periods of 3 years, it currently doesn't, its authorization is expired. Now, because Rosa DeLauro is a senior on the House Appropriations Committee, which is the funding committee, basically the federal funding committee, the bill has continued to get funded. Not only has it continued to get funded, but it's gotten funded at higher levels. However, we believe that it still needs to be authorized just as a formality, A, and B, because it provides us the opportunity to dramatically increase the funding level, which we are doing, and also to provide for programmatic enhancements and to make changes to the statute. So last year, for Ovarian Cancer Awareness Month, we worked with Representative Rosa DeLauro, who is a survivor, an ovarian cancer survivor herself. She chairs the Congressional Ovarian Cancer Caucus. She is our biggest congressional champion. We worked with her to introduce legislation to reauthorize the program and make some changes. Now, since its introduction, this bill has gotten 12 co-sponsors. That's not a ton. Co-sponsors are a showing of support. That basically means that a member is endorsing said piece of legislation. It's important, if you want any bill to advance, to get more co-sponsors. So I think Cheryl's message is around activations that we do, which, as an aside, all of you should sign up for our action alerts on our website. But when the bill was first introduced to reauthorize Johanna's Law, we sent out an activation. And Cheryl is asking about doing another activation. Here's where we are. We're at the end of this Congress. We are working with the DeLauro office to enhance some of the language around disparities, in particular with the reauthorization, and make some changes for next Congress. We're really kind of keeping our powder dry until we reintroduce next Congress. So I hope that gives you some perspective, Cheryl. I just scanned your messages, but it remains a priority. But as far as ranking kind of where things are right now, it's something that we're really gearing up more and going hard toward at the beginning of next year when the new Congress starts, just because at this point, the juice isn't worth the squeeze when it comes to other issues and the fact that all bills die at the end of this Congress.
I think, oh, Cheryl, we still can't hear you for whatever reason. It says you're not muted, but we just can't I don't know. Are we able to hear anybody else?
Can you hear me?
Can you hear me?
Okay, I can hear,
Yeah.
yes, I can hear other people,
Oh,
but I still can't
okay.
hear Cheryl.
Hello.
Maybe Cheryl, have you unmuted yourself?
She did. She's unmuted. It's just you can't hear her. Well, I'll just note that, and just keep talking until we'll stop if we ever do hear you, Cheryl. And I'm sorry that we're having that issue right now. But what I wanted to note is that that Johanna's Law, as Vanessa mentioned, while it has lapsed its authorization, it has been funding, and in fact, it's been funded at increased levels over the past few years. We've been really pushing to try to increase the funding for this program. And for FY 2020, it was funded at $9 million, which is $1.5 million more than it had ever received. And our hope is that we can grow that significantly so that it's authorized at, I think we have it at 15 million a year. So we'd like to see that the funding for that program significantly increased. And it would also, according to the language that we have, do a few different things, allow for the better dissemination of materials, and also seek to address disparities that specifically, along with a few other things. And so we're really hopeful that we can make that eventual legislation be enacted, but probably not this Congress.
Yeah, so long answer, Cheryl, is it remains a priority, and we're gearing up for January when the new Congress is sworn in.
Yeah.
Any other questions? I'm trying to scroll through the box here to see.
I have a question.
Yes,
Yeah.
who is that?
It's Gary.
Gary, there he is. Hi, Gary.
Yes, you were talking about having grass roots, or let's say grass tops, whatever it was, support on the state level. And my observation is when we come to Washington, you supply us with asks, specific things that we can go and leverage our relationship with our congressmen and ask for. We don't have those same targets on a state level.
Mm-hmm.
So is there any way that you can help us? From our standpoint, we have survivors to deal with. There's always another survivor that wants attention and everything. So we're not ending up going out and looking for ways to go after our state representatives. We have plenty of work to do right now.
Yeah.
If you could give us some targets, then we'll make some relationships, and or if there's a way to get some targets, we'll make some relationships and go ask for those things.
I'm so glad that you asked that question, Gary. And because, as we mentioned, we hadn't been doing a lot of state level work apart from trying to establish some state level commissions, but we are furiously working on the update of our state report card, the 50 states of teal. And what that does is it looks at every state and compares it to all the other states on how they're doing with respect to making sure that the ovarian cancer community is taken care of. That once we're done with that report card, it will identify several issue areas for each state that they need to work on to improve. So each state will have sort of a checklist on what they can do to improve the situation for the ovarian cancer community. And once that is done, we'll help people identify who they should talk to about addressing those concerns. So that will hopefully be done this fall, and
That's
then we
right.
can share that with everyone.
That's right, Chad. And the one thing that I'll add, that will provide concrete steps and be a guide map. And I think that, we've been delinquent for various reasons on updating it, but it's great because it gives you really concrete things that you can go to your electeds at the state level and make those asks, just like you were saying, Gary. The second thing that I'll add is we do have model legislation. And I say that it kind of comes with a grain of salt, that, you know, we are smaller and crunchier. So it's not like an AHIP model legislation or something like that, but it's important. And we started this working group. It was an outgrowth of the Advocate Leaders program, actually. And the concept is as follows. We've seen in 2 states, and it's thanks to the hard work of our advocate leaders, Diane Roche and Susan Layton, but in Massachusetts and in Alabama, they both respectively created gynecologic study commissions. And what these study commissions were charged with doing is taking a deep dive into the state, figuring out what patients with gynecologic cancers needed, what they were getting, what they weren't getting, you know, to really sort of assess it at the population health level, and then to submit a report with their findings along with recommendations for legislation to respond to some of these issues, but that they would submit that report to the governor and the legislature after a year. So because this has happened, here we have in Alabama, the reddest of the red state, right? And then you have Massachusetts, the bluest of the blue. And because it doesn't cost state legislators anything, and we have this model language, we convened a state working group. And Frida, this should be ringing some bells to you, for you, because this, I think we seeded this like a year and a half ago. Anyway, the point of the story is that there are 7 states in this working group, and Kim Richardson, I don't know if she's on the call, but hats off to her, because yes, she was successful. She was part of this working group, and she got the furthest in getting Illinois and getting the bill, the language introduced in the Illinois State Assembly. But things have been delayed because of COVID, and it's kind of hard to get people's attention. And we are going to pick back those efforts, but, and this is probably not a very satisfying answer, but we're reassessing things, but we would still like to carry forth because we think that that's a really worthwhile and important thing to do. And it's also rather shocking when you peel back the layers of some of these states. I mean, a lot of them aren't even collecting data on ovarian cancer. Like that's kind of what we're looking at. So Gary, I guess there are so many needs at the state level, and because you guys are our boots on the ground, grass tops as advocate leaders, we are hoping to kind of further leverage that, but things have been stymied by COVID.
Okay, who else has questions? We got a little time left before we need to send you over to the closing session.
I don't have a question, but I would just like to say that I was one of those original people sitting around a conference table, a very small group of advocate leaders, scared to death, not knowing why I got myself involved in that, and seeing Chad and Vanessa, how you've grown the program and the importance and the way you train us, and we are so prepared to go out and advocate. It's just really been an amazing process to watch over the last 5 or 6 years to see how this program has grown. I can still remember sitting in the basement of that hotel in Virginia with about a dozen women, 3 who are no longer here, and learning what I was supposed to do and being scared to death going up on the hill. And thank you for all you've done to grow this program, because it's so important and so needed, and giving us the confidence and the knowledge to do it. So thank you.
Oh, Frida, thanks for saying that.
Yeah, thank you, Frida, and to the other half of the dynamic duo. We really appreciate that. And I also want to encourage people to read Cheryl's comment in the, I really wish we could talk to you, Cheryl. Her comment in the chat about, Cheryl is the type of person who is not afraid to talk to anyone. And that includes any member of Congress who that she might come across. And she's really a testament to the force of will of one person. And you know, you can look a little bit about the comments that, read through the comments that she's made about the effort. Johanna's Law would not exist without Cheryl and the work that she did. And it's had a tremendous, tremendous impact, millions and millions of dollars worth of educational material, and undoubtedly has saved lives. And so it's no wonder that Cheryl is really focused on moving forward with Johanna's Law and its reauthorization, and we as an organization are committed to doing that as well. Frankly, I wish we would have gotten it reauthorized this year, because as Cheryl points out, you never know what the future holds. But we're hopeful that Rosa's position in this next Congress will afford her the opportunity to finally get this reauthorized and passed. And so hopefully that will be what happens, and we'll work hand in hand to make sure it does. And thank you, Cheryl, for keeping us focused on that issue and for that work. Anybody else have anything that they'd like to share?
If possible, I'd like to just introduce myself. I'm brand new here. I'm a 2-year out stage 4C ovarian cancer survivor, I suppose. And I really want to get involved. And so I want to thank you for your great presentation. I'm just thrilled to meet you all on Zoom. And I don't know how I'm going to begin or what I'm going to do, but I guess I'll start with Rohan.
Start with Rohan, yes.
So thank you. That's all I didn't want to take up any more time, but just to introduce myself.
Well, if you don't mind, Elizabeth, where are you from?
I'm
Where do you
in Los Angeles, California.
Great, that's right. We have California is one of the states where we are working to try to get some things to happen at the level.
State level.
Oh,
And I will say, so your state is so special. I mean, I, for one, like feel like every time I go to California, I'm like, why do you live anywhere else but California? It's so beautiful. But at the state level, it is notoriously difficult to get things done because you have so many different groups and apparently a lot of infighting. All of that being said, I'm intrigued. And we do have, that is one of our state level commission groups. So please reach out. And thank you for coming, especially here at the tail end of conference. It's great to have you here.
And as Shay mentioned, stay safe. Geez, what a crazy
time. It is.
Yes.
I would like to introduce myself too. My name is Nancy Shapiro-Fuchs, and I sit on the board of the South Carolina Ovarian Cancer Foundation of the Low Country in fundraising and development. And our STS program is amazing. It's Sue Summercrest that runs it. You're probably familiar with her because I guess they run it through you. What we do for the community is probably the same that you're doing too, only we do it on a very, local area. When we find somebody diagnosed with ovarian cancer, they get, from the doctor, we supply bags of hope with blankets and cups and journals and everything you need. Then we also have a lunch bunch where we take all survivors out for lunch and we pick up the bill for it. However, we've had to do it virtual, but everybody got a gift certificate from Chick-fil-A so that we could, all eat together.
Yeah.
But it's important for the local communities and for all of us together to work together and to try to stop this horrible disease from carrying on.
Yeah, thank you.
For sure. And
Thank
what
you
is
so
it?
much,
Tipper
Nancy.
O'Neill said, what is it? All politics is local. Like the local level it's where the rubber hits the road. It is so important. And I think, it's terrible with diseases where the survival rate isn't as high because in the context of advocacy, you can't have the same visibility, right? And we are a smaller disease community, so it's so important.
And more importantly, I have low grade, serous carcinoma, and I was stage 3A, and I am 6 years dormant.
That's what we like to hear.
Yes.
Yay,
Yes.
that's wonderful.
Yes.
I want to mention again,
Carla, yes.
if anyone knows anyone in Florida who is a survivor or a family member who we could interest in, helping out with the advocate leader stuff here, please contact me through Chad or through Rohan or through Vanessa, because I'm it for Florida, and this state seems to just be getting bigger and bigger all the time. So
That's right.
And also the other states that there are some states with no representation. There's a list available somewhere. So, think about your friends elsewhere, not just yourselves. And really, Florida needs more than me.
Yes, I saw that. I think that it was Mylin who said that she's from Florida in the chat too. So we'll try to make sure that we get you hooked up with other Floridians. Because yes, you do a great job down there, Carla, but we should give you some reinforcements.
Yeah. We should have the advocate leaders that are on the call introduce themselves.
Yes,
I'm Jan Byrne. I'm the sole person from the great red state of Utah. Got my colors mixed up, sorry. State of Utah, and we would love to have more people from the Intermountain West, because there's nobody in the states surrounding Utah either, but a lot of people from those states come to Utah for treatment, but we'd always love to see more people.
Absolutely.
I'm Denise Slobodinsky, and I'm an advocate leader from Georgia. And if you apply and you don't get picked, apply the next year. That's what I did, and I did get picked. But and we're looking for more people from our state too.
I'm Frida Weeks, and I'm from the great state of New York. I live in Syracuse, and Syracuse is great. I always love to meet fellow New Yorkers who want to advocate with me. So come on aboard. And even if you don't get picked as an advocate leader, come for a fly-in and learn and go with us, because there's power in numbers. And it's so amazing to see that sea of teal on Capitol Hill. So heartwarming, and it's an exciting time.
Thanks, Frida.
I'm Ellen Engel. I'm from Maryland, right here in the DC area. And I'm going to say the same thing. Please come, even if you're not an advocate leader, especially for the Marylanders. You have no excuse. You're very close by. And I'd like to have some reinforcements instead of just me.
Thanks, Ellen. We do have a couple more advocate leaders. We are almost out of time, so please just try to jump in quickly so we can get your faces and names.
Hello, I'm Vernelia McKnight. I'm from Memphis, Tennessee, but I live in Oklahoma, and so I'm a new advocate leader. And I was able to visit DC in March, and my first time on the Hill, and it was, I don't even know how to explain it, but I had a lot of fun. I learned a lot of information. And so this is my first time. So if you are interested, I can't even remember how I found out about it. I just applied, and I was so excited when someone called me and wanted to set up an interview, and here I am. And I'm a first-year ovarian cancer survivor, stage 1C.
And so let me brag on Vernelia for a second, because here's the thing. Representative Tom Cole, who's a powerhouse in the House of Representatives, he's a Republican, and he is really conservative when it comes to the budget and funding and all this stuff. He never gets on sign-on letters. Because of this girl right here, he signed on for our DOD letter, and we got that funding level. So it's awesome.
All right. Sorry, everybody. That is a great story, but we're going to have to close on that because we've run out of time. I'm sorry. We want to make sure we get you over to the